Please join me in welcoming Dr. Hartke. There you go.
Well, we're getting set up here. Thank you, Charlie, and the Reproductive Rights Committee of the Milwaukee League of Women Voters. And thank you, League, for all the things that you do to help us be more informed and to help our society be better in so many different ways. And thank you for Sherry sharing her personal story. Those are difficult things for people to share, and I know we have some other people here who have done a lot of great work in sharing their stories so people understand what's really happening to individual lives. So there are, yes, very dire consequences to the impact of abortion restrictions in Wisconsin. And just to take us back a little bit, a lot of you might not even remember these times, but I see some young faces here. I started college in 1972 before we had rights to our body. And I know one person here that actually went to Mexico to have an abortion during that time period, which was a very scary thing and had complications and bleeding on return. So this was a terrible time. My mentors, when I started residency, told me about these septic abortion wards. There were, in every major city in the country, there were hospitals that had abortion wards where women were dying of sepsis, of severe infection because of trying to do self-induced abortions. Cook County had a 40-bed ward in Chicago. And at that time, that picture of is women who called themselves the Janes. This was in 1972, also known as the Service. And these very brave women defied the law and provided 11,000 safe abortions to women in Chicago. Let's not go back there. And there's a very real risk of that. I want to just show you the trailer of the HBO movie that you should probably try and find.
We were ordinary women trying to save women's lives.
But we were criminals. We were felons. For most of the nation, in 72, abortion was illegal.
We had to go underground.
The woman would be given the address to the front.
It was probably obvious to neighbors what was going on.
We came to the Service from other things, the anti-war movement, the civil rights movement.
You couldn't not pay attention to what was going on.
Fetal death is murder.
You could not work as a pregnant woman. If you weren't married, you were out of luck.
They were terrible situations.
The septic abortion ward was full every day.
Women did awful things.
They were literally dying because they were women.
So we thought we can be of use. I said, we could use my phone, but change it so that they don't ask for Eleanor. How about Jane? Nobody's called Jane anymore.
We had the phone numbers on bulletin boards around Chicago. Pregnant, call Jane.
The clientele included daughters, wives, mistresses of police, state's attorney, judges.
It dawned on me how big an issue this was.
Jane was an outrageous undertaking by a lot of smart women.
I was not there to pass judgment.
I knew there were women like me.
Under the radar of the Chicago Mafia and police department.
We were all being watched.
The phone rings. A man says, we know where you are.
There were 11 counts of conspiracy to commit abortion, 110 years for each of us. So that's a long time.
That might have ended Jane right then and there.
I couldn't see myself sitting on the sidelines.
We were building a new world, one woman at a time.
Sometimes you have to stand up to illegitimate authority. And sometimes there are unjust laws that need to be challenged.
Sometimes there are legitimate laws that need to be challenged, and we have to be on watch right now, very much so. So in January of '73, the Supreme Court issued the 7-2 decision on Jane Roe that gave women in the United States a fundamental right to choose whether to have an abortion without excessive government restriction, striking down the Texas abortion ban. And then, as you know, in 2022, June 24th, on a Friday, the Supreme Court changed all that, and the Constitution does not confer a right to abortion, overruled the authority of Roe and Casey, and gave the authority to regulate abortion returned to the people and their elected representatives, in other words, in the states. Wisconsin abortion stopped. Anything that was scheduled the next day at Planned Parenthood stopped. I got calls that day. I got a message from a doctor that I worked with for many years saying, I'm on call this weekend, what are we supposed to do? And we had already met with the Legislative Council for the American College of OBGYN in Wisconsin, talking about, what different hospitals were doing with their legal counsel. And nobody could agree on what was going to happen, but the fact was there was going to be this interpretation of the law that said we could not do abortions. And she said, what do I do if a woman comes in at 18 weeks pregnant and she's got ruptured membranes and the umbilical cord is in the vagina, and what are we supposed to do? And I said, I don't know, I can't tell you what to do, but I would, one, call your board, your hospital board, and two, do what you were trained to do. And if it were me, I would do what I knew how to do to do the right thing for that woman. If it meant going to jail, I would have done it, because we are not going to let women die on our watch. At least I'm not. And the only woman that I lost during my whole career was during residency, and she choked on something and could not be brought to the hospital in time, and we did a post-mortem cesarean section but did not save the baby. So there are terrible binds that people were put into. There was significant provider distress. You could either do a felony and get up to 6 years in prison, loss of license, and $10,000 fine. Every time we get a law like this passed in Wisconsin, there's a huge fine and prison attached to it. Or commit malpractice and potential death of a woman. And my colleague on the left was serving Planned Parenthood at the Sheboygan Clinic and was in the lawsuit, was named in the lawsuit against Planned Parenthood for doing abortions by the district attorney there, and then was also referred to the Medical Examining Board to hopefully take away her license. She then moved to Minnesota and is now working 15 days a month in Minnesota because she does not want to work here right now until things get straightened out. But, I mean, this is what happens. We drive people away. The person on the right, Sarah Thompson, is an OBGYN in Idaho. Idaho has it much worse. And those people have a much stricter law, and they are actually airlifting women who need to have treatment to other states like Washington, Oregon, and Utah, because they know that the worst thing that they could do is, never recover from losing a mother that they know could be saved. And so we're put in this horrible bind. Since Roe was overturned, there's been a number of studies of moral distress of doctors across the country. In one, 96% of providers who care for pregnant women in states with restrictive laws reported feelings of moral distress ranging from uncomfortable to intense to worst possible. In a survey of OBGYNs who mostly were not abortion providers, more than 90% said the laws had prevented them or their colleagues from providing standard medical care. They described feeling muzzled, handcuffed, and straitjacketed. In another study, OBGYN residents reported feeling like puppets, a hypocrite, or a robot of the state under the abortion bans. I look at what happened in China where there were forced abortions. If we let the government tell us what to do with our bodies, it could go either way. So, you know, it's not just that you can't get an abortion. At some point, you might be forced to have an abortion. Abortion is health care, and it's a woman's right. And the 1849 law did not refer to abortion, so it was overturned, that interpretation, and now we have legal abortion since September 18th of 2023, performed in Madison, Milwaukee, Sheboygan, up to 22 weeks gestation. Now, I know there are other hospitals that do abortions, because when I was on the a chairman of the department, I got our board at my hospital to approve abortions for lethal anomalies in the life of the mother. And so rather than sending them somewhere else in a community where they weren't from with no support system, we did them at our hospital. And I was trained at Mount Sinai from 1983 to 87. Mount Sinai was a Jewish hospital, and the Jewish people believe that life begins when you start your first breath. And we were the referral hospital for the whole state of Wisconsin. So hospitals, Catholic hospitals, hospitals that didn't have a provider would send their sickest patients to us when we were residents. I got the best training I could ever hope for at Mount Sinai, now Aurora Sinai, and I am so grateful for that. So I was actually the consultant for a lot of the doctors at my community hospital when they had both a woman with a lethal anomaly or a life-threatening condition, but also a fetal demise, because you have to use the same procedure if the mother has a fetus that dies in utero. You have to evacuate the uterus, and you have to know how to do that. You have to be trained, and it's you know, it does require some skill. So we worry about the training of residents now, and we'll hear more about that in a minute. But one of the things that happens in pregnancy is intimate partner violence increases. So it's a risk being pregnant. And you can lose your life when you're pregnant. When I was on maternal mortality review, we saw homicides every 2 months when we reviewed cases. There were suicides because of severe distress and mental health conditions. And it also causes negative health behavior like alcohol and drug abuse, smoking, low birth weight, reproductive losses, complications of delivery, and of course physical and mental health complications, just the physical injury of some of the violence that we saw. And there were some really horrible cases. So just being pregnant puts your life at risk for so many reasons. And so if someone doesn't want to be pregnant, they should have that option. It doesn't matter what the reason is. It's not me to judge, just like they said on that video. I am not the judge, but I certainly would give them all the options so that they could make an informed decision. Each year, 324,000 pregnant women in the United States are battered by their intimate partners. And this is very serious for both the mother and the infant. This shows where the abortion policy stood in 2022. Wisconsin was restrictive, but you can see the red or the bright orange, Idaho, the southern states, South Dakota, it's worse there. And we know now that there are cases in Georgia that actually, because of Dobbs, women have died. Same thing with Idaho. So even before this reversal, there were trap laws. These are targeted restrictions on abortion providers, and they're designed to shut down abortion providers and centers through costly and medically unnecessary requirements. There's a whole list here of Wisconsin trap laws. They've tried all kinds of things. In 2013, they required abortion providers to have hospital admitting privileges. And some of my friends that were doing some terminations in Milwaukee had to work with some of the hospitals to try and get that resolved so we could still have care in our city. But public funding has been banned, private insurance limits it. You have to have an ultrasound. So when they were debating this bill, I got a call from the Legislative Council on a Saturday afternoon, and I thought, why is this person calling me? Well, the original bill had required a vaginal ultrasound. And she said, is there any reason that you'd have to have a vaginal ultrasound before an abortion? And I said, no. that's assault, basically. And you had to have an ultrasound even if you'd had already had one at a doctor's office. So this was totally unnecessary, extra cost, and not, these are just ways to try and make it difficult. And the doctor had to read a script. So it's ridiculous. There's also a 24-hour waiting period. And so if you live in a rural area where you're not close to one of those 3 places, you may have to travel a long way. And the same physician that does the counseling has to give the pills if you're doing a medication abortion and watch the person take the pills. So now she might have to be there for 2 or 3 days and pay for the transportation, maybe pay for childcare. It's every single thing that they can make a barrier they've tried to do. And then came the 20-week post-fertilization ban. So this is unnecessarily confusing. We date pregnancy based on last menstrual period. So post-fertilization usually is 2 weeks later. So this is actually, you can have a termination up to 22 weeks of pregnancy based on obstetrical dating. But that caused confusion. So when my colleague in Madison, an OBGYN doctor, found out at her anatomy scan at 20 weeks that she had a trisomy that was lethal. And the risk managers at that hospital said, oh no, this hospital can't do that. And she had to go to Northwestern in Illinois. Insurance wouldn't cover it out of state. She had to start a GoFundMe. It can be up to $25,000 to have a termination in the 2nd trimester. And then you're out of your community where your family is, your support. So this hit home right away for one of my friends. And this is still the case if you're past 22 weeks. In 2013, they passed this ultrasound ban, or the ban that we talked about. And if you violate that, it's a forfeiture of anywhere from $1,000 to $10,000 in civil liabilities. So the only exception is for life and health of the mother, rape, and incest as far as this ultrasound requirement. So most of you know, if you have anybody that's in your family that's had a pregnancy recently, that we typically look with ultrasound at 20 weeks. And if a woman doesn't want to do that, that's okay. But most women do, and they think they're going to do it because they want to find out if they're having a boy or a girl. But that's not why we do it. We do it to see that the baby's healthy and the fetus doesn't have any severe complications and anomalies. When you find out, it's very devastating. And you have to, sit down and give the parents all the information, let them digest it. You can't make a decision overnight. It takes time, and if they choose to carry the pregnancy, we support them. If they choose to have the delivery and have palliative care, we set that up. We have a comprehensive birth plan, and we have sometimes a team with the neonatologist, the perinatologist, the obstetrician, the nurses, the ethics committee at hospitals. This is a complicated process that we make sure that everybody's on board and that the mother has what she wants for this pregnancy. But I can tell you that almost all of my patients, if they knew that their life was in danger or that they had a lethal anomaly of the fetus, they didn't want to continue the pregnancy. And it's really hard to walk around knowing that your baby's going to die. You might die in utero, might die when it's born. People are asking you, oh, what are you having? Is it boy or girl? When do you do? It's just so emotionally just unbearable for those women. And they think about it for a day or two, and most of them decide that they want to have a termination. We tried at my hospital to make a list at one point of all the conditions to satisfy the board. You can't do that. Every case is so individual, and you don't know what you're going to do until you're there. And so we just have to leave it up to the providers and the people that deal with these kinds of things all the time to help give the right information to the patient and the family. I did have a woman who had a trisomy 15, and she wanted to carry her pregnancy. We got to 35 weeks. She got very sick. She had HELLP syndrome, severe hypertension, which is preeclampsia, only it can turn into eclampsia, with low platelets, liver function problems, and she was very sick. So we induced her at 35 weeks. And the baby was born with a heartbeat, very slow. And I stayed with her until the heartbeat stopped and checked it periodically. It was 2 hours until that happened. During that time, I had the staff call 7 different hospital chaplains till we could find someone who would come in the middle of the night and baptize the baby and be with that mother. We can talk big and say, yeah, you should just have these babies, but then who's there to support them? Not only in those situations, but when there's, financial situations, housing situations, all those other things. Luckily, we have checks and balances, and I testified against the 4 abortion bills that were up for just for vote in 2019, and they passed the legislature, but I was invited to the veto by Governor Evers so that we didn't have those go into effect. And I feel strongly that when we have the knowledge that I've been fortunate to get, that we have to go there and speak and stand up for this. But at one of those hearings, I heard from Wisconsin Right to Life that they want to get rid of contraception. They don't want insurance to have contraception. They don't even want natural family planning. And we have a Wisconsin legislator that said, we need a bigger workforce, so women have to have more babies. And you're hearing that in the discussion in this time period right now. We need more babies. So just have them babies, just have some more babies. That's not how it works. So as co-chair of maternal mortality, this is a big job. And in 2020, 900 women in the United States died of pregnancy complications, a 14% increase from the year before and a 30% increase from 2018. The number of women who experienced pregnancy-related complications was also increased to 50,000. And we saw in Wisconsin that we had 49 deaths of pregnant women in 2020. In 2010, there were 25, and we are having less births than we were then. So less births, more deaths. And for every woman that dies, there's 70 to 100 women that have a serious complication, could be even life-changing, stroke, or I know one of my partners in practice had a patient that ended up with a liver transplant after a baby. One of the questions that we ask, would she have died if she was not pregnant? And if it's pregnancy related, she wouldn't have died if she were not pregnant. The risk of death in pregnancy is 14 times greater with childbirth than with abortion. Homicides and suicides, as I mentioned, are increasing in pregnancy and the postpartum period, particularly 6 to 12 months postpartum. We're seeing way more deaths than we have before. Medical complications of pregnancies are going up. More women are having cardiomyopathy and congestive heart failure. You can get diabetes. One woman was offered termination. She had end-stage renal disease, and the pregnancy can worsen that. She opted to continue the pregnancy and then died. So there are so many situations that if they could get an abortion, it could save their life. I had a set of twins at one of the hospitals that was a religious, faith-based hospital. 21 weeks, the bag of waters broke on one of the twins, and that gestation is not viable. I offered to transfer her to the community hospital where we could take care of the pregnancy and keep her safe. The staff convinced her that no, that wasn't necessary, that she should stay there. And despite antibiotics, she got very seriously ill, had 105 fever. Fortunately, her body knew enough to start labor, and we got her delivered safely, but she was very sick and could potentially have had complications due to damage to her tubes and not been able to get pregnant again. So when you have premature rupture of membranes, that's one of the things they talk about. I know there's the story that has been told in the news about a pregnant woman in Texas who had to go out of state to get treatment for the same situation. A preventable death is one that has some chance of being averted if more than one of the system's family provider facility did something different. And so we're always looking at preventable deaths, and about 80 to 90% of the deaths we reviewed are preventable. A pregnancy-related death is one that's due to something specifically from pregnancy, a complication, infection, bleeding, things like that, or a chain of events that in pregnancy that lead to the complication. You can see in 2020, we went from 38 deaths to 49 deaths in Wisconsin, a 30% increase in pregnancy-associated deaths, and there were 21 deaths that were pregnancy-related, 43%. Of those pregnancy-related deaths, 38% were caused by mental health conditions, and 88% were due to overdose. So we've got a lot of work to do. And if you're not pregnant, a lot of that stress and that mental health problems can be treated much more effectively. We know racism plays a role in pregnancy-related deaths, and we are looking at every case. We've got some sophisticated ways now, and there's a lot of research in how to examine the record to find clues that there could have been racism that contributed to that death. As far as we know right now, I talked to the epidemiologist last week from DHS. We don't have any cases of maternal deaths specifically related to the Dobbs decision in Wisconsin. But there's been plenty in other states. Pregnancy Justice is a group that I've worked with for a number of years after I had a woman come asking for help because she was taking some of her mom's Percocet and she knew that was not good for her baby. And the ER doc called the police and they took her away to jail, and then they put her in a locked psych unit in St. Luke's in Racine. And I called, it used to be National Advocates for Pregnant Women. They've recently changed their name to Pregnancy Justice because it's not just women that are having babies, but trans men who are cis women and are trans men can have babies. So they're being much more inclusive, and we are trying to do that with our research for maternal mortality review as well. There were 210 pregnancy-related prosecutions in the first year after Dobbs, with the highest number documented in a single year that Pregnancy Justice researched. And the prosecutions overwhelmingly charged pregnant women with offenses that allowed them to obtain convictions without having to prove that the pregnant person harmed the fetus or infant. 199 of 220 charges lacked a harm requirement. So in some states, especially in the South, if you have a miscarriage, they can charge you with, killing your baby. If you have a stillbirth, women are being put in prison because they had a stillbirth. They're saying that they caused it when they don't have to prove that there is that direct harm. And this is unconscionable. In Wisconsin, we have this cocaine mom law that you heard about, which is actually a personhood bill. It's under the child laws, and a woman can be reported to be using a substance or go in to get their Medicaid to get coverage, so they have insurance for their pregnancy, and say that they were using a substance, but they've stopped because they know they're not supposed to be using it. But if you have an aggressive intake person, they can report you, and then you can be forced to go into treatment, sometimes inpatient treatment far away, or they'll lock you up in jail. And I testified in the one case where we helped Tammy Lesher, who was put in jail and actually put in solitary confinement for a couple of days because she wouldn't give him another pregnancy test, which is ridiculous because the whole reason she was there. But there was another case, Alicia Beltran, who went before the judge, and it turns out that the fetus had a guardian ad litem, but she didn't get any representation. And she said, if I wasn't pregnant, this would all go away. And the judge said, yes, but you can't have an abortion. We won't let you do that. So You lose your rights when you're pregnant in Wisconsin. You don't get an attorney if you get charged with something like this. In 2021 in Texas, after the ban, the infant deaths actually went up in that state. And then there's the impact of the OBGYN workforce in Wisconsin. So even if you're practicing out of restrictive states, people fear face the fear of civil or criminal charges, fines, loss of medical licensure, among other possibilities. So if somebody in Texas goes to another state, someone in Texas can sue that person, the taxi driver or the doctor, whomever. In 2022, we had a 20% increase in death threats to doctors and 229% increase in stalking incidents compared to 2021. There are fewer maternal mortality providers now. There's more maternity care deserts. There's higher rates of maternal mortality and infant death, especially of women of color. There's a higher overall death rates for women of reproductive age, and there's greater racial inequities across the healthcare systems. Access to care is critical for mothers and babies. In Wisconsin, after 60 days, if you're above the 100% poverty level, you lose your Medicaid coverage. We've tried to get it extended to 12 months. Hasn't worked. I just saw in the newspaper today that we have turned down $1 billion+ because we haven't expanded Medicaid. It's going to other states. We need that money. We've paid our taxes to the federal government. It's our money. We should get it back. In the last decade, 11 rural hospitals have stopped delivering babies in Wisconsin, according to the Office of Rural Health. A maternity care desert is a county that has no hospitals that provide obstetrical care, no birth centers, no OBGYNs, and no certified midwives. Wisconsin has 15 counties that are maternity care deserts. They're losing, because of the closings, we have a stress on our whole healthcare market, and obstetricians are leaving our state. So when a couple years ago at Ascension St. Mary's, there were 12 OBGYNs. It went down to 4. I don't know what they have at the moment. All the OBGYNs just left the Menominee Falls, and they closed that birth center in Menominee Falls. I just heard somebody yesterday saying that there's another rural hospital that's closing its birth center. We have a physician shortage, and obstetricians are leaving our state and they're going to other states. And nobody wants to come here. So every week I get calls, text messages, emails, asking if I'll do a locums position at one of our Wisconsin hospitals because they're desperate for doctors and people don't want to come here. Same thing in Idaho. They've lost, 55 doctors or something. But that means that people aren't getting preventive care either. So if we want to go to the OBGYN, there might not be an opening for a long time. And so it's impacting everybody. We went to Washington, D.C. 10 or 15 years ago with ACOG and said there's going to be a physician shortage. The baby boomers are retiring. We're going to see a really big problem here. And they wouldn't approve of the increased funding to have more residency spots and more medical school spots. And now because of COVID, more people retired and the boomers retiring, and then these bans, it's made it even worse. Wisconsin OBGYN residency applications decreased by 8% in 2023 and another 10% in 2024. So we're not getting the doctors that likely will stay in our state if they train here. This is a really sad statistic. After the Dobbs decision, we saw a sharp increase in tubal ligations and vasectomies among young people, women in their 20s, because they were so afraid of getting pregnant and not being able to have an abortion. And the tubal ligations went up twice as fast as the vasectomies, but even the men were concerned. And that leads to regret, because I can't tell you how many professional women were busy and waited until their late 30s and then wanted to have a family, and because of age couldn't. But I think that we're going to see a lot of those young people change their mind 10, 15 years from then. We've had additional bans, and this is a hard one. I don't have anything against Catholics, but they run a third of the hospitals of Wisconsin, and many procedures are off limits. So there's a growing number of systems that limit reproductive health care, and in some instances, physicians are prohibited from informing patients about treatment options that are not permitted at the hospital, depriving patients of valuable information and the option of going elsewhere for treatment if alternatives exist in their community. Now, there's some communities in Wisconsin that there's only a Catholic hospital. There's lack of transparency, and I object to that, and I would love to write a bill that they have to be transparent about that. This shows all the Catholic hospitals in our state, and because of ethical and religious directives and this set of rules written by the U.S. Conference of Catholic Bishops, they ban abortions, contraception, and sterilization, as well as in vitro fertilization. So if you have a C-section in a Catholic hospital and you have 5 kids at home and you want to have your tubes tied, your abdomen is open, it'll take me 3 minutes to tie your tubes, you can't have it. Now, when I was at a Catholic hospital during my practice, we could go to the ethics committee, get a form signed, and if there was reasonable, reasons to do a tubal ligation, it was pretty automatic. But that changed in about 2019 across the state. You cannot have a sterilization and you can't have a vasectomy. So now if you want sterilization, a woman would have to go to an outpatient clinic after 6 weeks, pay another copay, another anesthesia, which is a risk, another surgery, which is a risk. Maybe you've got a baby at home. Maybe you have to take time off of work. And one of the biggest reasons people go to abortion clinics is because they were denied a sterilization at the time of their delivery. This is not ethical to me. I really am sad about this quote. In reproductive care, Catholic ethics can trump medical best practice. Bishops can wield more influence than physicians, and patients can be denied care they desire or need. And the Catholic health systems argue that they serve as safety nets in impoverished communities and provide the same quality of care as secular hospitals, which that's not true from what I just said. They do. St. Joseph's in Milwaukee almost closed in 2018, and I was on several calls with doctors that were trying to help keep it open because they serve the people of that community, which is predominantly black, low income, and they already have significant challenges. Nearly a third of the people there live in poverty, and black infants born there are more than twice as likely to die as white infants. The 3 core values of reproductive justice are the right to have a child, the right to not have a child, and the right to parent a child or children in safe and healthy environments. And we're not doing a very good job. As far as racial disparities in Wisconsin, 45% of Hispanic women give birth in Catholic hospitals, and Wisconsin is the only state where black women are more likely to give birth in Catholic hospitals than non-Catholic hospitals. And the number of Catholic hospitals are rising in Wisconsin, and the secular hospitals are decreasing. And on black women, 52% of them in Wisconsin deliver their child in a Catholic hospital, the highest percentage in the nation, according to Columbia Law researchers. The bans won't stop unless we take action. In January of this year, the Assembly approved a bill by a vote of 53 to 46 that would call for a binding statewide referendum to ban abortion after 14 weeks of pregnancy. No Senate vote was taken because they knew that if they did pass it, it would get vetoed, so they didn't want to waste their time. But they're not going to stop. And we have to be on guard. So in 2019, when I think this was when we had the 4 abortion bills that I testified against, I went to the rally at the Capitol, that we need to stop the bans. We need to do everything we can. And we also need to call our legislators to codify Roe versus Wade. That can happen. And we need to be calling our federal legislators. And why? Because women's lives matter. We can't let this happen. So, for the election, confirm you are registered, know your voting place, learn about the candidates, support candidates who uphold your values, and bring 3 more voters, and vote. Make sure you vote. And don't forget the back side of your ballot has an amendment. I think the league has an opinion on that one. Vote no. All right. Thank you very much for your attention.